CNA Practice Test questions and answers.
The range of motion term abduction means
A,
moving the extremity away from the body,
B,
moving the extremity toward the body,
C,
moving the extremity above the body,
D,
moving the extremity below the body. Correct answer, A. Moving the extremity away from the body. To abduct is to move away. To adduct is to move closer or toward. Which of the following most addresses a client's needs in regard to spirituality?
A,
Ask the client why he or she is of a particular faith.
B,
Provide the client with warm water, soap, and towels every morning.
C,
Assist the client to the facility's chapel every Sunday.
D.
Treat any religious objects in the client's room as if they were any other. Correct answer, C. Assist the client to the facility's chapel every Sunday. Support the client in their own individual religious needs. Treat any religious objects in their room with respect. Proper body mechanics when lifting clients involve which of the following?
A,
Keep the spine curved.
B,
Bending at the waist.
C,
Bending at the knees.
D.
Avoid seeking assistance. Correct answer, C. Bending at the knees. Bending at the knees is the only proper body mechanic listed. Avoid doing all the others. Which of the following would be a primary indication of hepatitis?
A,
Hypertension,
B,
hyperglycemia,
C,
jaundice,
D.
hypotension. Correct answer, C. Jaundice. Jaundice, also known as yellowing of the skin, occurs frequently in cases of hepatitis, liver disease. Which of the following aspects of care is important for a confused client?
A,
Checking the client's blood sugar every hour.
B,
Asking the client their name.
C,
Keeping the client contained in their room.
D.
Reorienting the client frequently with clocks, calendars, and family mementos. Correct answer, D. Reorienting the client frequently with clocks, calendars, and family mementos. Reorienting the patient frequently is the most important aspect of care. Keeping the client locked in their room could agitate them, as could asking them their name, which they might not remember. What type of client may opt to receive hospice care?
A,
Client with kidney disease.
B,
Client with cancer.
C,
Terminally ill client.
D.
Client with diabetes. Correct answer, C. Terminally ill client. Terminally ill clients may receive hospice care, which is designed to relieve pain rather than to cure disease. Cheyne-Stokes respirations occur in a client who
A,
has a history of chronic respiratory issues,
B,
is unconscious,
C,
is recovering from an asthma attack,
D.
is close to death. Correct answer, D, is close to death. Cheyne-Stokes respirations are a breathing pattern marked by increased respirations, labored breathing, and periods of apnea, no breathing. It is important to report these signs if discovered in a resident who is not expected to show them. A client in the day room is having a panic attack. The nursing assistant should
A,
tell the client to breathe as slowly and deeply as possible.
B,
Have the client talk about the panic attack.
C,
Encourage the client to verbalize their feelings.
D.
Ask the client about the cause of the panic attack. Correct answer, A. Tell the client to breathe as slowly and deeply as possible. During a panic attack, the nursing assistant should make the client comfortable and encourage them to breathe slowly and deeply. Asking them to count backwards slowly from 100 can also be helpful. During an attack, the client is unable to talk about anxious situations and isn't able to address uncomfortable feelings and frustrations. While having a panic attack, the client is also unable to focus on anything other than the symptoms, so the client won't be able to discuss the cause of the attack. Which of the following residents is demonstrating orthopneic position?
A,
A resident sits in a chair with their back straight.
B,
A resident sits on the side of the bed and leans forward over a bedside table.
C,
A resident walks using a cane.
D,
A resident lays on their stomach with their face to the side. Correct answer, B. A resident sits on the side of the bed and leans forward over a bedside table. Orthopneic position is meant to assist in breathing. Leaning forward makes it easier to get air into the lungs. A resident is choosing items for breakfast. Which of the following items contains the most amount of potassium?
A, eggs, B, cantaloupe, C, toast, D,
Strawberries. Correct answer, B.
cantaloupe.
Cantaloupe is a melon that contains massive amounts of potassium. Other foods that contain high potassium include bananas and dark leafy greens. When helping a client with left-sided weakness due to a CVA, the nursing assistant should position the client's cane
A,
in front of the client,
B,
on the left side,
C,
on the right side,
D,
away from the client. Correct answer, C. On the right side. The nursing assistant should place the cane on the side that is the strongest so that it can support the weak side. CPR, cardiopulmonary resuscitation, should be performed when
A,
a client is unconscious,
B,
a client is choking,
C,
a client has no pulse and is not breathing,
D,
a client has a pulse but is not breathing. Correct answer, C. A client has no pulse and is not breathing. CPR is performed on a client that has no pulse and is not breathing. A nursing assistant enters a client's room and finds a fire burning in a trash can. The nursing assistant's first action is to
A, call the nurse for help. B,
remove the patient,
C,
try to put out the fire,
D,
pull the fire alarm. Correct answer, B. Remove the patient. The acronym RACE is used for fire situations: rescue, alarm, contain, extinguish. First, you must rescue the client to prevent harm. Log rolling is a technique best used for which of the following patient diagnoses?
A,
Left tibial fracture,
B,
spinal cord injury SCI,
C,
cellulitis of the right arm,
D,
psychosis. Correct answer, B. Spinal cord injury SCI. A SCI patient is prone to further damage and injury to the spinal cord if the legs cross over the midline in a twisting motion. This can be avoided with proper log rolling technique. When a client constantly ignores the urge to void, the client is putting themselves in danger of what complication?
A,
Constipation,
B,
incontinence,
C,
insomnia,
D,
poor appetite. Correct answer, B. Incontinence. Incontinence can occur if the bladder becomes too full and is unrelieved. Which of the following types of grief is considered a normal and healthy part of grieving?
A,
Anticipatory,
B,
complicated,
C,
unresolved,
D,
inhibited. Correct answer. A. Anticipatory. Anticipatory grief occurs before the loss actually happens and is a normal part of grieving. Complicated, unresolved, and inhibited grieving indicate there is a problem with recovering from the loss. A patient is on a clear liquid diet. Which of the following is not allowed on this diet?
A.
Water.
B. Tea. C. Coffee. D.
Orange juice with pulp. Correct answer. D. Orange juice with pulp. Orange juice with pulp is not allowed. The pulp is not considered part of clear liquid. Tea, coffee, and water are all allowed on the clear liquid diet. A client with a Foley catheter is ordered to ambulate twice daily. Before ambulating the client, the nursing assistant should
A.
keep the bag below the bladder level.
B.
Raise the bag above the bladder level.
C.
Have the patient cover the bag with a pillow sleeve.
D.
Ask the nurse to confirm this order. Correct answer. A. Keep the bag below the bladder level. Keeping the bag below the level of the cavity ensures that bacteria cannot migrate up from the bag and up into the bladder due to gravity. Which of the following items is necessary in order to place a patient in restraints?
A.
The hospital administrator's approval.
B.
The charge nurse's approval.
C.
Physical restraints.
D.
A physician's order. Correct answer. D. A physician's order. The physician needs to order restraints before they can be legally applied. No one else can ask for restraints for a patient, or it is considered battery. A client eats a bagel and 1 large glass of orange juice. What is the correct way to record the amount of juice?
A. B.
120 cc.
C.
120 milliliters.
D.
480 milliliters. Correct answer. D. 480 milliliters. The abbreviation of cc is no longer appropriate in the medical field. Only ml should be used. A large glass is 480 milliliters. One of the patients on the unit is on airborne precautions due to suspected tuberculosis. To rule out the disease, the doctor has ordered sputum specimens to be collected. What is the best daily time for the nursing assistant to collect the specimens?
A.
Before a meal.
B.
After a meal.
C.
First thing in the morning.
D.
Last thing before the patient goes to sleep. Correct answer, C. First thing in the morning. The sputum produced upon awakening is the most concentrated sputum and will yield the most accurate result. The nursing assistant walks into a patient's room and discovers him masturbating. Which of the following actions is correct?
A.
Scold the patient and tell him he should be ashamed of himself.
B.
Exit the room to provide privacy for the patient.
C.
Report the activity to the nurse in charge.
D.
Ask the patient why he is doing this to himself. Correct answer. B. Exit the room to provide privacy for the patient. Masturbation is a normal expression of sexual health. Attempt to exit quietly without disturbing the client in order to preserve his privacy and decency. The nursing assistant cares for a client who is extremely agitated. She yells, screams, and frequently tries to bite staff. The nursing assistant should
A.
use restraints to ensure the client's safety.
B.
Speak calmly in an authoritative and neutral manner to the client.
C.
Use the television to distract the client.
D.
Provide care only when absolutely necessary. Correct answer. B. Speak calmly in an authoritative and neutral manner to the client. Speaking calmly in a neutral manner can soothe an agitated client. Restraints are not appropriate for a client who is merely confused and can be placated. A client with a terminal illness tells the nurse that he has begun praying every night. The client states, "If I pray every night, God will forgive me." This represents which stage of grief?
A.
Acceptance.
B.
Bargaining.
C.
Denial.
D.
Anger. Correct answer. B. Bargaining. This patient is bargaining to be forgiven in order to cure his illness. This is a normal stage in the grieving process. Which of the following pieces of assistive equipment would be most helpful in moving an immobile client from their bed to a chair?
A.
Mechanical lift.
B.
Draw sheet.
C.
Gait belt.
D.
Wrist restraints. Correct answer. A. Mechanical lift. A mechanical lift should be used for immobile or NWB residents. A gait belt should never be used on an immobile resident to lift them and should be used on individuals who are FWB or PWB. The nursing assistant prepares to give a patient a bed bath. Before turning the patient to rub their back, the nursing assistant notices that he has a Foley catheter in place. Where should the nursing assistant secure the catheter to ensure it is not pulled during the bath?
A.
To the lateral aspect of the patient's thigh.
B.
To the bed sheet.
C.
To the medial aspect of the patient's thigh.
D.
To the bed. Correct answer. A. To the lateral aspect of the patient's thigh. Securing the catheter to the lateral aspect of the patient's thigh ensures it cannot be painfully pulled during the bath. A patient has just received news about the death of his spouse. He states to the nursing assistant, "I can't believe this has happened to me. I don't know what to do. How can I live without my wife?" The nursing assistant best responds by stating,
A.
"You will need more time to cope with this loss."
B.
"I understand you're in pain. I'll stay with you."
C.
This kind of thing will happen to everyone eventually.
D.
Do you and your wife have any children together? Correct answer. B. I understand you're in pain. I'll stay with you. This is the best answer because it reflects what the patient is feeling, pain, and stays with the patient to comfort him. The nursing assistant helps a patient who recently had a right-sided stroke to bathe. Which of the following describes the best method to support the patient's independence?
A.
Allow the patient to perform as much of the bath as possible.
B.
Ask the patient what he wants to do.
C.
Complete the entire bath for him to conserve his energy.
D.
Encourage the patient to do the best he can to clean himself. Correct answer. A. Allow the patient to perform as much of the bath as possible. It is best for the patient to perform as much of the bath as possible, with the nursing assistant helping out when necessary. A resident comes out of their room saying they have burned their leg after they dropped hot soup on it. The skin looks blistered and red. The nurse assistant knows this is A. Superficial burn.
B.
Partial thickness burn.
C.
Total thickness burn.
D.
Serious burn. Correct answer. B. Partial thickness burn. This describes a partial thickness burn. A total thickness burn appears waxy and white, while a superficial burn might be described as blotchiness of the skin with no blistering. A client who has not had a bowel movement in 4 days would receive the most benefit from which of the following procedures?
A.
Endoscopy.
B.
Colonoscopy.
C.
Catheterization.
D.
Enema. Correct answer. D. Enema. An enema will help the patient in expelling fecal matter before it can become impacted.